Welcome to our webinar titled Candid Conversations Regarding Transplant. Thank you for joining us. My name is Leigh Clark, patient educator, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting the program today. Due to the high volume of teleconferences on the internet, it is possible you may lose your connection during the program. If you're unable to view the program, you can call in to hear the audio portion using the call-in number in your reminder email. Today's program will be available within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. During the presentation, there will be a question and answer session. Please feel free to submit your questions at any time during the presentation. To submit your question or comment, open the Q&A window in the lower part of your screen. Just type in your question or comment, and we'll be answering questions throughout the program. We'll do our best to get to everyone's questions today. When asking questions, I do ask that you do 2 things to help me manage the incoming questions. First, submit your question all at the same time. Second, please do not share any private health information in your question. Our panelists are not healthcare professionals and cannot answer your healthcare questions. Our panelists today, we have Dwayne, Pam, and Barry. Thank you all for joining us today, and I'm going to give you guys just a few minutes to introduce yourselves. Pam, would you like to start?
No, but I will. Hi, I'm Pam Caraviti. My son Nick had a bone marrow transplant because he had severe aplastic anemia. We were fortunate that his younger sister was a 10 out of 10 match for him. The other 2 siblings were not even close. And so he is recovering and doing well now.
You. Dwayne, would you like to go next?
Sure. I'm Dwayne Draper. I live in Pawleys Island, South Carolina. And I was diagnosed with MDS back in September of 2009. I came back at intermediate high risk on the IPSS risk scoring scale. So I was kind of pushed forward fairly quickly to a transplant. I had the transplant in January of 2010. And everything has been fine since. Look forward to any questions that come through, and certainly will do my best to answer any of them and hopefully provide some guidance and some hope for people that may be going through this process in the future.
Thank you, Dwayne. Barry?
Hi, let's see. I'm in Minnesota. I was diagnosed in 2010 at a routine physical, kind of set things in motion, and then got diagnosed a few months later with low risk MDS. And then in 2018, things went south, and in December of 2018, I had my bone marrow transplant. And it's really been exactly 2 years now, 2 years as of yesterday when I received my cells. There have been some challenges, but in general, I have progressed very well, and I'm very happy and I'm very pleased with my care team.
Thank you so much. We can get started. How did you come about deciding that a bone marrow transplant was the best option for you? Dwayne, would you like to start?
Sure. Well, as I mentioned, I was diagnosed as intermediate high. I was otherwise healthy, maybe similar to Barry. I had gone in August of 2009 for my annual physical and got some standard blood work done, only my doctor decided to call for a CBC, or a complete blood count, which he didn't normally, but Boy, am I glad he did. Because all of my counts came back extremely low, the whites, the reds, and the platelets. And so I went down the path pretty quickly to getting diagnosed with MDS, and the fact that it was intermediate high, and the fact that I had no other comorbidities, as they're known, or other health issues like diabetes or heart, high blood pressure, heart issues. I was considered a pretty good candidate for transplant, and they recommended that I go down that path fairly quickly. I knew there was a lot of potential danger with the transplant because it's a very rigorous process, but I felt that I had everything on my side, health-wise, otherwise, so I decided to go ahead with it, and we started the search for a donor.
Did you have a related or an unrelated match?
It was an unrelated match. Both my sister and my brother were tested, and they were not considered viable. So we went into the unrelated match donor pool, and I was told by my oncologist, hematologist in New York City, I had this done at Sloan Kettering in New York City, and she said, because of my Northern European background and ancestry, that probably almost any cop or fireman in New York might be a potential donor. So as it turned out, I had over 1,000 potential donors in the database, and then it was just a matter of contacting them. And I think it was the third or fourth donor that they contacted who said they were still willing to go ahead and do that.
And Pam, it was a little different for you because you were the parent, and so you had to kind of make those decisions. And how did you guys kind of make the decision that transplant was going to be the best choice?
I mean, everything happened so quickly. Nick was 13. It was 2014. And he was just a healthy young boy. He was playing on 2 baseball teams and playing on a basketball league. And all of a sudden, all these bruises were showing up on him, which I still didn't really think was too big of a deal because he played rough. And then the little red dots, the petechiae, started showing on his skin, and I took him to the pediatrician, and he did blood work, and he said, I want you to go right to the hospital. Don't go home first. Go right there. And there was an entourage of doctors waiting for us when the doors opened. So I knew it wasn't good. And then they wanted to do a bone marrow biopsy right away. And his platelets, the normal range is what, 150,000 to 350,000. He was at 3,200 at the pediatrician's office and 1,600 by the time we got to the hospital. They said normal people would have been on the ground at that point, but he was a young boy, so he just kept going and didn't really know how to articulate that he was feeling tired. And the next morning they did the biopsy and explained within 2 days he was diagnosed, and he had severe aplastic anemia, and they said his best chances are a bone marrow transplant. And so we immediately had the siblings tested, and it just moved really quickly. Within 4 weeks, we were in the hospital going through chemo and transplant. But during that stretch to get there, he kept getting infections, and it started to seem to me that that's really when it's really bad, is before transplant or before treatment. But we were fortunate that we got through everything, and he's doing really well now.
Did Nick have a related or an unrelated transplant?
Related. His little sister was a match for him. She was 5 at the time.
And was there ever a discussion about using drug therapy, ATG? Did you ever was there ever that consideration before going to or before trying transplant?
That was the path that we would have taken if we didn't have a donor. They were going to look at the siblings first, then if we didn't have a match there, go to the registry, and if not, then the treatment.
Okay, thank you. Barry?
Yes, so let's see, in December of 2017, I was doing a little cross-country skiing with my son. And in April of 2018, I was having trouble walking further than about 200 yards without being out of breath. So I thought it might just be temporary, so I kept living with it until even at rest, I was having trouble catching my breath. Went to get my blood tested at the University of Minnesota, where 6 months before I had just met a BMT specialist who actually I met through AAMDS at one of the conferences. And so she was a little surprised to see me. We got the results of the blood test back rather quickly. The next day I had my first blood transfusion. All my counts were much lower than previously. I had been seen every 3 months from 2010 until 2018, just watch and wait. And I felt pretty good. I was working full time. And by June 6th of 2018, I was needing blood transfusions, talked to the BMT specialist. She said, "You're on your way to a transplant. Let's try azacitidine first." Not because it's going to solve the problem, but it could put you in better shape. Your counts are way down. This can help in a number of ways. So I went through azacitidine treatment in the summer of 2018 through the fall of 2018. Ended up going into the hospital for febrile neutropenia in October. Got that cleared up. My hemoglobin was doing better. My platelets were doing better. My white count was almost non-existent, hence the febrile neutropenia. Talked to the doctor again. She said, let's see if we can get you in for a transplant in the next month. So why did that seem like the most beneficial option? Is because I said to her, and what if I don't have the transplant? And she said, I'll give you 6 months. And I said, oh, okay. I hear transplants are very tough. And she said, yes. And I pushed her a little bit and she said, those next 6 months may not be very pretty. So I already knew I was going to have the transplant. I just wanted her to sell it to me a little bit. And so at the end of November, I started my induction treatments for the transplant. I had cord blood. So, and I knew nothing about all of the possibilities like Dwayne talked about. I left it in her and her team's hands, and this is what they came up with. And I just trust the doctor. I go with my gut with these things, and my trust for her just tremendous. So that's how it came about.
Thank you. And what were you told about the potential risk and benefits of the transplant? Pam, would you like to start this time?
Sure. You know, I don't remember really addressing the risks because it was just about saving his life. We didn't, they explained to us that aplastic anemia, unlike cancer, our doctor said, picture it like a lawn, your front lawn. And with cancer, you have weeds popping up, and they're trying to kill the weeds, Where with aplastic anemia, the whole lawn is wiped out. And so what we needed to do was, there was a little patch of bad bone marrow, a little patch of grass that would never spread out to be a lawn. And the donor would be the reseeding of the lawn. So the chemo would kill the bad piece, donor would reseed the lawn, and that would be our best chances. And so once we knew we had a donor, I guess there wasn't, the risks probably were between Nick and his little sister, Mandy. They needed to get enough bone marrow from a 5-year-old to give to a 13, almost 14-year-old, taking enough that it would work, and then, but not taking so much that it would put her in danger. So I think the risks were more for her.
Dwayne? Dwayne?
Oh, I'm sorry, I didn't
Can
hear
you
you.
hear me okay?
Yeah, I can.
What were you told about the risk and benefits of transplant?
Well, first I was told that my intermediate high designation on the risk scale for MDS left unchecked. You know, there could be some treatments along the way, and there certainly were, but left unchecked, I might only be looking at about a 3-year survivorship potentially. So that kind of that was the first thing that sharpened my mind quickly. And then as far as I actually had a stem cell transplant. I didn't have a true bone marrow transplant, but they said that they kind of divided it up into thirds in terms of odds. And I don't know if that's still valid today as it was 11 years ago. But they said that a third of patients that go through the transplant process survive the transplant and go on and beat MDS and live, you know, long, productive lives. A third of people that go through the transplant process don't even survive the transplant process because it is very, very rigorous. It involves chemo. It involves a lot of other medications, many of which cause swelling. There's complications like graft versus host disease. And then the other third, they said, usually survive the transplant process, but at some point may relapse back and have MDS come to the forefront again. So I was faced with what I viewed to be a 33% odds in being successful and being curative, although most doctors won't use that word cure. But it is the only potentially curative process available for patients with bone marrow cancers. So looking at, you know, a potential 3-year survivorship without doing the transplant, but not having any other health issues, I just felt a little bit tired, and I was 58, 59 at the time. And I thought, well, it's just what 58 feels like. I wasn't as out of breath as much as Barry was, but I could see myself maybe going down that path. So I rolled the dice, basically knowing that I was really healthy otherwise. I really didn't have any other issues, period. And decided to move forward with it.
Barry?
So in some ways it was very easy. Even though I have a fair bit of skepticism as far as prognoses go, I had done a lot of research on my own. And so when the doc said, I really only see 6 months for you, and I asked, well, sell me the transplant, she said, I have patients who I actually don't see anymore because they're doing fine and they don't need me. I was telling her about what I knew about transplants, just like Dwayne mentioned. And I went through a lot of complications post-transplant. It was very hard. But I had already been in the hospital for 10 days with that febrile neutropenia, and I'm not going to go into details, but it was very uncomfortable. I had already had periods of time where I couldn't walk very far, and movement and exercise and being physical is very important to me. So it wasn't really a choice for me. I either had a chance to get my health back or a certainty that I wasn't going to. And of course, there's always outliers, but I was already feeling crummy. So, but going real quickly, just in terms of, I spent 8 years feeling good. I spent every 3 months asking my outpatient hematologist oncologist, well, is there anything we can do? Is there anything we can do? And he said to me that he weighs toxicity versus benefits. And I was doing so well that the rigors of any therapy, such as the azacitidine with hypomethylating agent, or some of the other possibilities, he said, they're not worth it right now. There's too much toxicity, not enough benefit for you. And then I was already toxic, so to speak, and everything was a benefit.
How did anyone discuss with you the chance of graft versus host disease? And did you, or do you now suffer for any type of graft versus host disease? Barry, would you like to start?
So the doc and I didn't get into it very much, which is just the way we talk. She knows I do a lot of research. We may have mentioned it. Yeah, it's a possibility. What's it look like? Well, it looks different for a lot of people. Well, what about this? Yes, that's possible, or this is possible. And we'll cross that road when we get there. We have a lot of treatments to help you with it. And that's about as far as we got. And then I suffered severe acute graft versus host during my hospital stay at Transplant. I probably suffered some later. Right now, I'm just weaning from an anti-GVHD med, and so we'll see how that goes. But I've already started, and I'm still feeling good. So that's a long answer to your question.
And how long were you in the hospital, Barry, after your transplant?
So too long. I have great experience to help people with, which is fortunate or unfortunate. I was in the hospital for 7 weeks, which is with cord blood transplant, 2 to 3 weeks longer than people who don't have complications. And I had more than just the GVHD complication. So, but I was there for 7 weeks. It got old. The silver lining was physical therapy, occupational therapy, because as I said, I need to be physical. And if I could work with the therapists, I was able to handle it. And I would ask for more therapy even as I was getting total peritoneal nutrition because I couldn't eat. So I had to be not just tube fed, but intravenously fed.
Pam, was graft versus host disease discussed with you all before Nick's transplant, and did he suffer any GVHD?
Yes, it was discussed, but again, basically they said he has a 50% chance of survival if we take the other road. If we do the transplant, he has an 80% chance. And so it was discussed, but you know, like Barry said, we're going to cross that bridge when we came to it. And he never did have graft versus host, but instead he had this battle going back and forth between his cells and Mandy's cells. I guess there's 3 factions, and Mandy's cells had taken over 2 of the factions 100%, but not the T cells. And so they would battle back and forth. One day it'd be 80% Nick and 20 Mandy. And that would open up the door for those bad cells to take over the other 2 factions, and we would have to start all over again. So his biggest problem was having to be on steroids and all these things to encourage Mandy's cells to overtake his in that last faction. And we're still not 100% sure. They just stopped testing because it was making us all crazy, you know? So in the words of the Rolling Stones, you don't always get what you want, but sometimes you get what you need. So hopefully we do have just what we need.
And how long was Nick hospitalized?
He was, like Barry, he was about 7 weeks. He had a lot of, we went in for transplant, and then, as you know, what keeps you alive are the transfusions, and he was getting infections, that he had a sinus infection, and when you have any mold or anything going on, they don't want to do anything. So it was a long process getting him ready to go and safely be able to pull the trigger. And then it was a week of chemo, and that was just awful. And as you guys know, it was heartbreaking. And then, you know, and then a day break, and then transplant. A lot of, you know, psychologists, and for both he and Mandy, and just a lot of pain and a lot of stuff you have to do to get well. But if you do it all, you do everything they tell you to, you get there with a lot of humor. We used a lot of humor.
Thank you, Pam. Dwayne?
Yeah, first of all, I got to say, I really admire Pam to go through that whole process. To be a caregiver is very tough anyway, because I saw it with my wife. But to have her 2 children, both children, so deep into this whole scenario, I really applaud you all for getting through that.
Thank you.
Yeah, I did have discussions with doctors about graft versus host disease, not to any huge extent. I think most of my familiarity with GVHD, like Barry, came through my own research after learning about AAMDS Foundation and all the different resources that are available. I found myself going online quite a bit and doing some of my own research. So I was pretty familiar with it. And what the possible complications could have been. I didn't have any issues with GVHD until I was probably 5 months after the transplant. I was in the hospital, Sloan Kettering, for about a month. I had a few complications while I went through the procedure. I had a lot of swelling. I think that a lot of that was probably from steroids and other medications. At one point, my kidneys started shutting down and they put me in the ICU on dialysis. And it was touch and go for a few days, apparently. I didn't know much of what was going on. But GVHD didn't rear its head until probably 5 months after the transplant, and I was back home. And it was kind of a mild form of it in a sense of a kind of a severe rash all over my back. And they were able to treat that with a topical agent and went away within a matter of weeks. I was also told that early on that a little bit of GVH is a good thing to help you get through your transplant. And I forget the exact reasons why, but it helps you get, get the acceptance of the donor stem cells. So a little bit of GVH is not a bad thing, but it can really go off the rails and attack your organs too. So I was aware of all of that, but like Barry, you kind of roll the dice and figure these are my best odds. I've got to go with this. I'm confident, and nothing else going on to prevent me from going through the process. So.
Thank you. How did you decide on what center that you were going to use for your transplant? Dwayne, would you like to go ahead and start with that one?
Yeah, sure. So this is kind of an interesting story, and it all has to do with insurance companies, as it usually does. But I was living in New Hampshire at the time, and I was diagnosed at Dana-Farber in Boston. A well-renowned transplant center and cancer center around the country. The company I was working for at the time had excellent medical coverage. However, this particular company, the carrier, did not recognize Dana-Farber as an approved transplant facility, which, as I later found out, was all a matter of negotiating the right contract, right? It all came down to the money. So my hematologist oncologist there, who I know does a lot of work with AAMDS Foundation, Richard Stone, actually referred me to a friend of his at Sloan Kettering in New York. Sloan Kettering was an approved facility under my insurance. And so my wife and I ended up moving to New York from New Hampshire. We found a house rental. We were fortunate to be able to do that was close enough to the city. And so we actually moved just outside of New York for 5 months so I could get the transplant down there at Sloan Kettering.
Thank you. Pam, how did you all decide where to have Nick's transplant?
We started out when the pediatrician sent us to the hospital. He sent us over to Beaumont in Royal Oak, Michigan. And we were so blessed that the doctor there, because my understanding from talking to people is aplastic anemia is really rare, so it's hard to diagnose. And the doctor there had just come from working at the Cleveland Clinic, and she had seen it before. So she had said that she was looking for either aplastic anemia or leukemia. And, at first, because I resisted the urge to research anything online, for me, when I heard aplastic anemia, I thought, okay, I hope it's that, because we can deal with anemia. And then she told me that no, it's harder to cure than leukemia. So it's not what we want. But once she did diagnose that, there happened to be a doctor at U of M that had seen another case of it. And so it was an hour away, but still in our own backyard, we had an incredible doctor there. And so we ended up there.
Thank you, Pam. Barry?
My choices, living in the Twin Cities in Minnesota, my choices were the University of Minnesota or an hour and a half away at Mayo Clinic. So I live pretty close to the university. I had already met this bone marrow transplant doc before I was having any symptoms, but just when my outpatient doc and I just thought, you know, Barry, you have a lot of questions. Why don't you just go meet somebody? And I said, I'd like to go meet somebody who might actually do the transplant because I love continuity. And I saw that the doc also had published and somebody told me she was considered an expert in MDS. So everything put together, my proximity to the university, the fact that it is a good university hospital, the doc I liked, I trusted, and that's so big. And she had she had a lot of credibility. So that made the decision for me.
And we have a question from our audience. Our question is, post-transplant, how often did you have a Chisholm test? Barry, would you like to start?
Yeah, I think it's chimerism,
Mm-hmm.
but if I understand what's meant by chimerism in terms of donor cells versus my cells, so I had that test done at each bone marrow biopsy after transplant. So I had it done at 3 months after transplant, 6 months after transplant, 1 year, and 2 years, 2 weeks ago. And for myself, thank God I have 100% donor. And part of that may be due to, as Dwayne mentioned, my acute GVHD in the hospital may have attacked any residual cells, of any residual of my mutated cells may have attacked those and made the transplant more successful. I do know that they said something about the donor cells seemed to be aggressive, but I have no idea why they said that.
Pam?
Because Mandy and Nick's cells were fighting back and forth, our chimerism was every week. And especially when it got to be Nick's cells overtaking Mandy's, and we still do not have 100% donor cells. But like Barry was saying, Nick never had graft versus host, so maybe that's why. But yeah, we are still doing chimerism tests, but now they're once a year. And they say they're subjective. It's like oil on top of water, you know, it's kind of, that's how they read it. So what looks like 60% to one may look like 40 to another. And but it is easier in our case because we have a male and female cells, so it's easier to see. But yeah, we still have the chimerism test.
Wayne?
You know, to be completely honest, I don't recall whether or not I had chimerism tests. And if I did, maybe I did. They weren't discussed with me specifically. And I don't know if that's a more recent phenomenon of 10, 11 years ago, they weren't doing that, or if that's just all part of the normal process with the testing that goes on. So I really don't know. I do know that my blood type went away and now I have my donor's blood type. And I suppose that's just a part of the process. My wife and I used to joke about whether I would develop different tastes for different kinds of foods, or I eat more hot things now than I didn't before. I don't know. A lot of it's science and a lot of it's just folklore, I guess, in a certain way. But whatever it was, it worked. And I'm thankful. And I finally got to meet my donor a couple of years ago. That was a great experience.
Awesome. And we have another question from the audience. Did your transplant doctor review the GVHD scales system of gut, liver, and skin with you? Dwayne, do you want to go ahead and go first on that one?
Yeah, just in general as to how GVHD might manifest itself. But as I mentioned earlier, the doctors didn't really get into too much detail about that. I think most of what I learned about it is through my own research.
Pam?
The same for us. We didn't really ever discuss it because there wasn't a need to. So yeah, I don't remember anything like that.
You're muted, Lee, but in terms of for me, they never discussed it. I actually only learned about the formal scale later on my own. But I tell you that in the hospital, I definitely had the highest grade of gut GVHD. Skin, not so much. What's the other big acute one? I can't remember. As Dwayne said, GVHD can attack any organ, but the acute tends to be skin, gut, and something else. So the answer is no.
We have a question regarding nutrition. Did a dietitian work with you after transplant? Did they have recommendations for you regarding nutrition after your transplants? Pam, would you like to go first?
Yeah, they did have a nutritionist, but as everyone knows, they don't want you eating from salad bars or, all the things that you would think you should eat that are going to make you healthy. Fruits, vegetables, all the things that need to be really washed well. They don't let you eat any of that. And, but yeah, we did have somebody talk with us about what Nick could eat.
And what about now, Pam? Are you guys still having to follow certain things for nutrition now?
No, no, I guess the beauty of being a young man is he goes on like nothing ever happened, and which is a blessing for him. As a parent, I'll never be there, but yeah, he can eat whatever he wants now.
Dwayne, what about nutrition for you?
Yeah, I think most of the focus, there's the obvious stuff about eating well to be healthy, but most of the focus was for the first 100 days post-transplant, as Pam was saying, it was more things to avoid. fruits and vegetables. Any kind of meat had to be cooked well done, which is just, total anathema to me. I like medium rare meat, but everything had to be very well cooked, so you couldn't do any takeout. I was told you could get pizza if you ordered it out, but told them not to cut it because they don't want you. Once you cut that knife, where's that knife been? So if you get a whole pizza and it's not cut, that was okay. No salad bars, certainly. But yeah, I think that the focus on the nutrition or dietetic part was more on what to avoid. Soft ripened cheeses. I love brie, so I had to hold my breath there for a few months. But I think all in all, it was all good advice, and we got through it okay. But yes, that first 100-day period, of course, is the key for getting through everything and moving on.
Thank you. Barry?
Yeah, my experiences were the same as Dwayne's and Pam's. And there was a lot of food I didn't want to eat anyway. I kind of lived on cookies for a while, and then I discovered Boost nutritional shakes, and eventually things got better.
Thank you. And this goes to Pam. It says, Pam, first, thank you so much for sharing your story. Second, do the kids still see a therapist?
Thank you so much for asking the question. It's after everything was done, I did take the entire family to therapy. Number one, Mandy was very young and she was always willing. We never had to talk her into it. We just told her she was the medicine that Nick needed to get well. And she was just always on board. She, of course, said she would do it for $5 and a ring pop. And when we got home from the hospital, our porch was covered with $5 bills and ring pops, but the two other boys would have done it for an iPhone, so I'm glad they weren't the match. But those two boys who fall in between Mandy and Nick, I felt like got shuffled under the carpet for quite a few months, and really the whole year, because I had to homeschool Nick. So we were in therapy, and they all came out just fine. They're all doing so well. I had a big fear about Mandy potentially getting used to the attention she was getting, because there were fundraisers. She was on the news. The Ellen DeGeneres show called and wanted to have the two of them on. And so I thought she was going to get a big head. So we tried to really play it low key. She doesn't even talk about it. You would never even know she did anything. And Nick has gone on like nothing ever happened. And really, everybody's great. But therapy early on, just to make sure, was good.
Thank you. Our next question from the audience: has anyone had any issues with secondary cancers related to the transplant regimen? Barry?
No, I have not. I'm 2 years out. I had a myoablative regimen, which was radiation and chemotherapy. And so I would think I'm at a higher risk due to that radiation. So, but so far, so good.
Wonderful, thank you. Dwayne?
I don't think I can say that I have. I had a recent basal cell carcinoma removed from my skin, but I think I blame that more on the sun than anything else over my years. I did have, and I can't say that this was related to anything through the whole process whatsoever, But just about 2 years ago, I had a mild heart attack and ended up with a double bypass surgery. So I'm running out of things. I go for the big stuff, not, small infections and that sort of thing. But I don't think that was related in any way, although I have read a few articles that once you're subjected to some sort of chemo, there's always the possibility that it can rear its head again. I think probably one of the best known cases of that was with Robin Roberts, host of Good Morning America, I believe it is. I don't watch those shows, but she had gone through, had breast cancer and had chemo years ago, and then her MDS followed that. So there may have been an association there, but fortunately, knock on wood, I haven't had any further issues.
Pam?
Yeah, we were told that, well, number one, that skin cancer our doctor told us he sees more skin cancer from transplant patients than anyone else. So probably the move from Michigan to Georgia wasn't the greatest idea, but Nick gets checked annually for skin. And they also told us that aplastic anemia can evolve into leukemia or MDS. So we're conscious of that and just keep a good eye. And thankfully we have his medicine, and Mandy, she's not going anywhere. So, but no, nothing thus far.
Thank you. We have another question from the audience that says, what are some of the things that you brought to the hospital to make your stay more comfortable? Pam?
Oh, this is fun. Yeah, I hung family pictures, even though, somebody said, well, I don't think you can do that. We did. This is kind of not, not tasteful, but bendy straws that they have in the hospital. Nick and I learned if you put one end under your arm and blow in the other end, it is just so much fun for a young man. You gotta keep humor in it, and just personal items, blankets, anything that meant something to Nicholas. He had won a karate tournament and the trophy was huge. It was 10 feet tall and we brought it. We brought everything that meant something to him.
Pam, did the hospital help provide you like a list of these are the things that we'd like for you that you can bring for Nick, and here are the things we don't want you to bring for Nick? Because I'm sure trying to find things to keep him occupied being, so young was difficult. Did they help you with some things to bring and not to bring?
We had a basic list, but another thing that really helped for Nick, his doctor, I'll never forget this. I had always raised money for Make-A-Wish for years leading up to this. And his doctor on our first meeting said, he qualifies for a wish. And it was just like a punch in the stomach, because you never think you're going to hear that. But we turned it around and we helped him. He wanted to do something that the whole family would benefit from. So he decided on a man cave. And so we got him a pad of paper. So when he was in the hospital, he could just dream up things to put in the man cave. And he loved that. He loved having that pad and being able to dream things up for the man cave.
Thank you. Dwayne?
I thought that would be a great opportunity. I knew I'd be in the hospital for close to a month, having the full intensity transplant. And I thought, what a great time to catch up on reading. But after 8 days of chemo and developing chemo brain, I didn't get a whole lot of reading done. I couldn't concentrate. But one of the things I watched a fair amount of TV. I'm kind of a news nut on current events and political stuff. And so I did a fair amount of that, but I also created my own personal page on Caring Bridge, the website that essentially you create your own page. You can add photos to it and you invite friends and family And that was my way to communicate and talk to friends and family through the Caring Bridge website. I would write on it like a log or a journal, and people would write back or send photos. Just a great way to, because I was limited as to how many people could come in to see me in an isolation room in New York City, let alone even being back close to home anywhere. So it really was isolation on a lot of different levels. So the Caring Bridge website and the page I created was just a fabulous resource, not only for me, but for friends and family to keep up with what was going on a day-to-day basis.
Thank you, Dwayne. Barry?
So like Dwayne, I thought I would get some reading done. And like Dwayne, I didn't. I brought my laptop with me. I've always used the computer quite a bit for 20 years. Nope, didn't use it. And as Pam and Dwayne were talking, I had to ask myself, what did I do? Because honestly, I don't remember so much other than I did puzzles. My girlfriend brought in some puzzles, and I spent a lot of time doing those. We had like 1,000-piece puzzles, so it took time. And when she was able to come to the hospital, we did some of it together. So the puzzles were really good. I didn't even watch that much TV. I really didn't feel good. And when I finally did start feeling better, I would do something physical in the room. I would start doing my Tai Chi that I had done for years and years. But there was a period of time where I did those puzzles, and I guess I just lay in bed. I'm kind of surprised.
Thank you, Barry. We have a question from the audience, and it says, I am terrified of the actual transplant process over that first month. How was your experience? Dwayne, would you like to start?
Yeah, well, the first 8 days, at least for the high intensity transplant that I received, was all chemo. And then there's a little bit of nausea associated with it, but it wasn't as bad as I thought it might be from stories that I'd heard. Then on the 9th day, you rest, and the 10th day, you get your actual transplant. And as I said, I had a stem cell transplant. So basically, it was just like an infusion of my donor's stem cells, just like getting an infusion of red blood cells. Probably in that second week, I started feeling some bloating. Wasn't sleeping well because they come in to weigh you and poke you and do all kinds of things every 2 or 3 hours anyway. So don't plan on getting any rest in a hospital. So I said I did have some issues with my kidneys starting to shut down, and I went to ICU for a little bit and on dialysis. But my appetite wasn't all that great. Lost my taste buds for the most part. Even after going home, after leaving the hospital after 30 days, that first 100 days, which is the the kind of the severe time of, you have to be careful not to get any infections. You have to make sure you're eating right, getting plenty of rest. I didn't get my taste buds back probably for about 6 months or so, which didn't help with having, the desire to eat things that you liked eating. But constant care, I can't say enough about the nurses, the doctors. I mean, the doctors actually they're pulling all the strings, but the nurses are who keep us alive on a daily basis.
Thank you. Barry?
So I cannot speak to a good hospital experience other than I really appreciated the nurses and the doctors. They were just great. and I let them know. I can't say enough about them. Again, Dwayne's path and mine are similar. As he said, I mean, my induction days with the radiation and chemo, they weren't bad. I was doing all the things I had been doing the week before I went into the hospital. And then following the transplant, things got very rough. I can tell you though, having gone through everything I went through, and now that I'm doing so well, I walk 2.5 miles, I do other things. My taste buds all came back finally. It was difficult to eat for certainly the first 100 days. Little by little, I started introducing some foods. Some things made me sick that didn't make me sick previously, so I didn't eat those. So I took things very slow. So I had a rotten experience. Even though my counts, I would get these great, the docs would come in and they'd say, hey, your counts are coming up. They look great. Well, I feel crummy, doc. But I wasn't angry at anybody. I just didn't feel good. But I can tell you it's been worth it. So even if it's difficult in the hospital, even if there are times when it gets difficult, yeah, we're terrified, but I can tell you that people get through it and they do very, very well. So.
Thank you, Barry. Pam?
Oh gosh, I'm hesitant to answer this given that the person asking is terrorized. I get it. So let me just say, when you come out on the other side, you're better for it. You're stronger. You're just a better person because the little stuff doesn't matter anymore. But yeah, it was awful. I mean, specifically during chemo, and as Nick's hair would fall out and the pain he was in and just how sick he was and not being able to eat. And it was awful. It was awful. But, like Barry and Dwayne said, when you come out on the other side, it's so worth it. And you're just a stronger, better person for it.
Yeah, if I can just interject here, I think it's all about attitude and setting the right expectation level. You've got to have a positive attitude, number one. And you've got to set the proper expectation level, because if you expect too much and you don't even get close to that, your positivity level just goes right down. So start out with low expectations, look for the silver linings, be positive. And if you can't do that on your own, draw that strength from all your friends and family, and they'll help you to get there.
Wayne, speaking of family and your loved ones and your friends, how critical and what are some of the things that they did that were able to help you and Barry and Pam get through the transplant process? Because it takes everyone to be part of the team and be part of the journey. So how did family and friends and everyone help you as patients, and Pam, for you, help you guys get through your journey? Dwayne, would you like to start?
Yeah, well, it's extremely important. I mean, you just can't underestimate the importance of the strength and the love that you pull from your family and your friends, however you need to do it. I had my wife with me, of course, the whole time. We had to move to New York, as I mentioned. We had some friends come down from time to visit, but very limited visitation in the isolation ward in the hospital. And like I also said, I used Caring Bridge as a link to be able to share thoughts. And I was told that my name was put on a lot of prayer lists, which made me feel great. And you really have to have those resources to get you through that, because being in an isolated room in a hospital for 30 days with so many needles and ports going into your chest or your arm, it can be a very depressing environment. And so you have to rely on others. I've always been a very self-reliant person most of my life. And that really hit me. I just had to say, hey, look, bud, you're not going to do this all by yourself. You better start relying on other people to help you get through this. And that's what I did.
Thank you. Barry?
So again, everything Dwayne said, I don't know. My girlfriend and my brothers who don't live in Minnesota, my girlfriend obviously does, but we were all, we're just gonna do the work. We're gonna do the work. And so that kind of got me through. I came up with the phrase of, I'm gonna live as well as I can. And there were no expectations from the people around me, which was great. There wasn't even an expectation that, oh, you know, you'll be doing great someday. It was just, we're gonna take it day by day. My name also was on a number of prayer lists. My colleagues would text me periodically, and I finally talked to them a little bit. I didn't feel like talking to anybody very much for a while. Now I can't shut up. I'm talking to them all the time. And my girlfriend opened her house to me after I left the hospital. I tried to rely on, I tried to get by with as little help as possible, which actually kind of sometimes makes other people angry. But that gave me a sense of, wow, I'm getting somewhere. I can do this, I can do that. So I don't know. I don't know that that's very helpful, but definitely the people who were in my life were supportive. And being in isolation is very hard.
Thank you, Barry. Pam, you have a little of a unique situation because you were the caregiver. Did you have folks around you that you were relying on? Because you had Nick and then you had kids at home. So
Yeah.
how did you kind of use your network to help you and to help the family?
Well, I'm with Dwayne and Barry. It's hard for me to accept help, but once you finally decide it's okay to do that, it's incredible how helpful people can be. Now, with me, I wanted so much for, our timing was interesting. Nick had just finished his 7th grade year and we were rolling into summer. So with that said, the other kids were out of school. So I wanted to take them with us to Ann Arbor so we could stay together as a family and keep things as normal as possible. And we had so much help with that. people driving to us to pick up the other kids and take them to parties so that they didn't lose their summer, but yet we were all together. And then somebody set up a Help Hope Live account for us where people were donating, kids from school were bringing in their allowances. It was crazy, the fundraisers, the outpouring of love and help. So everything we did, we were able to do, where I could be with Nick 24/7. U of M even had a program where the other kids could come and spend the day there. They had a basketball court. And so yeah, you just got to look for the little things that you can do to pull it all together.
Thank you so much, Dwayne, Pam, and Barry, for sharing your time and your stories and your expertise with all of us today. And if anyone would like to watch this webinar again at a later time, it will be available on our website within 2 to 3 business days. If there's anything that we can do to support you and your family, please reach out to us. You can reach us by email at help@aamds.org. Contact us on our helpline, which is 800-747-2820, extension 2, or reach out to us on our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. The AAMDSIF Medical Advisory Board and team are always here to support you and your family, as we've done for the past 36 years. This concludes our program today. Thank you all.
Thank you.